In Malawi, thousands of children are threatened by or have already had measles. An epidemic has been raging in the country since February, as well as in neighboring Zimbabwe, South Africa, and Mozambique. Since the beginning of the year, the number of patients has been growing weekly. More than 9,000 people have been affected. The country has not experienced an epidemic like this in 13 years, and the health services were not prepared to deal with such an emergency.
Some of the drugs that we needed were not readily available. For instance, vitamin A was not always available. But we have had, that has actually improved quite significantly. We've also had some support from MSF, who have given us some antibiotics, the vitamin A, which is also important.
Médecins Sans Frontières was already working in Malawi on an HIV program. Teams have been reinforced since the measles epidemic broke out, and today more than 1,300 people, mostly Malawians, are working in the field. They are working in collaboration with the Ministry of Health, training medical staff, providing vaccines and medications, case management, but most importantly, they're carrying out a vaccination campaign in the areas most affected by the epidemic.
So MSF is vaccinating children between the age of 6 months and 15 years in 6 districts, and in those 6 districts we will vaccinate approximately 3 million children.
The people from the communities, yes, they are aware that there is an outbreak, and of course they are concerned, and they have been, bringing their patients to the hospitals. They have been speaking about chikuku, like they call it, and it has been a concern. They have been asking, okay, what are we supposed to do, and what should I be vaccinated, or what kind of medication should I take, what is going to happen to me? There's a lot of concern from the community.
In a vaccination campaign of this scale, logistics are central to MSF's work.
It is everything from maintaining a certain temperature for the vaccine vials themselves, so from the time they reach the country until the time the injection is into the arm of the patient, everything has to be kept at a very specific temperature. This means ice packs, refrigerators, constantly running 24 hours a day, 7 days a week until the vaccination campaign is complete. It also means a huge fleet of vehicles in order to get the ice packs and the vaccines on site in time and to make sure the cold chain is not broken.
Measles is a highly contagious disease that spreads quickly through nasal secretions, sneezing, and coughing. It leads to fever and skin rash. Complications may occur, and if left untreated, 5 to 20% of patients die. Despite efforts to control the epidemic in Malawi, the spread of the disease remains of grave concern. In early June, 23 of the country's 28 districts exceeded the epidemic threshold. MSF decided to intensify its vaccination campaign and is urging that more funds be allocated to emergency vaccination. This is Northern Republic of Congo, or Congo-Brazzaville. These families are from the neighboring country, the Democratic Republic of Congo. They fled violence that rocked their province back home in late October 2009. More than 120,000 people crossed the Ubangi River, which separates the two Congos. Months later, they are still waiting to be able to live in acceptable conditions.
Our situation is difficult. We have no food or clothing, and no one is helping us.
Such precarious living conditions favor the development and spread of disease. Médecins Sans Frontières is providing aid throughout the area where the refugees have settled.
Suivi de malnutrition, il y en a peu en fait.
There's not much malnutrition.
Mais ce qui est le plus, en fait, l'épidémie.
The real epidemic is malaria. We see malaria patients every day. More than 40% of our consultations are for malaria patients.
The refugees have doubled or even quadrupled the number of inhabitants in the villages, forcing residents to share their resources.
Before, there were 137 inhabitants in the village. Now, there are more than 2,800 refugees with us.
International aid has not arrived, or in far too small quantities. The refugees have received a mere 700 tons of food in 6 months. Their needs are estimated at 1,800 tons per month.
The little that we received has already gone. What we need is rice, salt, and oil.
They are also worried about returning to the DRC. Both countries' governments assured the refugees that the situation has calmed and that they can return home. Most, however, have decided to stay in the Republic of Congo. They're afraid the conflict is not over.
These are people who live together and killed and injured each other. Will they be able to go back and live together again? The situation is difficult, and the return will be too.
Since the earthquake, more than 1 million Haitians have been living in precarious conditions in tents or under plastic sheeting. The situation has resulted in many domestic accidents. This man was living in a tent which was set on fire by a candle. He suffered severe burns. Johnny was electrocuted. His 2 forearms had to be amputated.
I'm an electrician. That's how it happened. I was working on the lines, and I got an electric shock. My arms were burned by the electricity.
Set up at the Saint-Louis Hospital in Port-au-Prince, this is the country's only specialized burn unit. Managed by Médecins Sans Frontières, the facility includes 3 tents housing approximately 30 beds and an operating room where the most fragile patients have their wounds dressed.
The skin protects the body against infectious agents, against germs. But when the patient loses his skin, he becomes very, very fragile.
Burns are frequent in Haiti, especially since the earthquake. People are living in crowded, confined spaces using candles for lighting and cooking with small portable stoves, solutions that run considerable risk of domestic accidents.
Most of the patients we see here have been burned by flames. It tends to be tents that catch fire, and the person inside gets burned. But we also see burns from boiling water, hot oil, and electrocution too.
Patients stay for several months, the time it takes for their wounds to heal. Patients like Johnny, who have had to undergo amputation, are also fitted with prostheses.
The future? I don't know. I don't have my arms anymore. But they're going to give me prostheses. I think I'll be able to work using my head because everything I've learned is in my head, so I'll still be able to work. That's my idea. What's in my head.
Important progress has been made in recent years in the fight against AIDS. Treatment was made more accessible and the quality of patients' lives has improved. However, while much work remains, that progress is now under threat. Médecins Sans Frontières is concerned by the current standstill or even reduction in funds allocated to the fight against HIV. Such a reduction would be disastrous for patients.
As we speak, people are dying of AIDS. Millions are dying. There is still 6 million in Africa waiting to start treatment. It means they will deteriorate, they will get ill, and they will die.
The primary actors are the Global Fund and PEPFAR, a program of the US government. They both envisage reducing their funding when they've not already done so. This specialized clinic in South Africa has been hit hard by this disengagement.
We were told at that stage that we couldn't put more patients on ARVs because of the funding was insufficient for that. So basically we had to turn those patients away. Those that couldn't start is worrying because quite often they were really very sick and we don't know how many of them died or what happened to them, unfortunately.
4 million people in the world are receiving AIDS treatment today. That's too few. Nearly 2 out of every 3 still lack access to antiretroviral drugs. That proportion could increase as financial resources decline.
MSF teams are increasingly confronted with requests for help. The Ministry of Health, local or international NGOs are asking us to step in with emergency supplies to avoid stockouts. In Malawi, the Minister of Health was facing a threat of stockout. MSF had to bring in emergency supplies for some 3 months or so.
Making progress in the fight against AIDS still requires time and effort. If nothing is done to revive donors' interest, patients who need treatment will be left behind, only to be joined by those whose treatment could be interrupted mid-course.